Kimberly Emmerling is in the best shape of her life, but for years her stomach didn't match the rest of her body.
I looked like I was 9 months pregnant.
Even though she was doing CrossFit 5 to 6 days a week.
All the crunches, planks, anything that was thrown my way, I was trying to flatten my stomach.
Turns out those were all the wrong exercises because she has diastasis recti. DR is when the muscles on either side of your stomach part because of organs pushing against the connective tissue that holds them together.
That layer is what keeps the insides in and everything else out, and that's also what makes the abdomen look flat.
Dr. Daniela Carusi of Brigham and Women's Hospital says it happens to almost all women during pregnancy, but
about 30 to 40% of women may permanently have some separation there after a pregnancy.
DR can cause low back pain, urinary incontinence, and constipation. But for most, it's just cosmetic, and surgery can fix it.
Hey, how are you? Good. How are you?
Good. But Kim didn't want to go under the knife, and in February found Caroline Johnson.
It offers people a way to heal a diastasis recti non-surgically.
Johnson teaches the Tupler technique, one of several programs developed by DR experts. It involves wearing a splint 24/7.
The purpose of this splint is to reposition the muscles back to where they should be. And then exhale back to fifth.
And breathing and abdominal muscle exercises for 6 to 18 weeks, depending on the size of the diastasis. For Kim, it was 15 weeks. If you think you have DR, here's how you check.
You would have your fingers pointing down towards your pelvis. Okay, you're going to bring your fingers in and then lift your head up slightly and then lower it down.
With DR, there is a gap between the muscles at least 2 to 3 fingers wide. Kim's was severe at 6 fingers.
In terms of everything, it's just given me more confidence, it's given me a happier body image, and I feel good. It's an actual physical good feeling.
Some doctors don't recognize how diastasis can affect your emotional and physical health and may not recommend treatment. You should seek out help from a provider who treats the condition and who may recommend a physical therapist who treats DR. For HealthLink, I'm Amity Addrisi.